Experiencing a traumatic event leaves its mark. About 9.2% of Canadians will have PTSD in their lifetime, according to the Government of Canada. I spoke with Margaret Powell, a psychotherapist and occupational therapist in Toronto, to answer some questions about how to deal with PTSD symptoms.
People can tend to minimize what's going on in their lives until they kind of get too much on their plate and their knees start to wobble and they start to feel like they're going to collapse.
So, how do you know when to seek help?
I would always encourage people to not wait, because when you're under so much stress from other events in your life and then your PTSD unresolved symptoms start to catch up with you, and then you go into collapse mode, well, then you're looking at not being able to continue at work, or being really short-tempered and irritable with family and friends and pushing people away, or going into, kind of a PTSD burnout state.
It doesn't take a lot to trigger a PTSD attack. Something as small as a smell or a texture can remind you of a traumatic event and make it feel as if you're reliving it.
The frontal cortex, where we think and plan, goes offline in perceptions of threat, and our reptilian brain, let's make ourselves safe, goes online. So talk therapy is not actually the best.
There are tactics to help, such as mindfulness, journaling, and nature bathing.
The problem is that when people are looking to get help, it's very difficult to get the kind of help they need, because we're still trying to crack the code of how to help people rewire their brains.
Powell suggested other forms of therapy that are better suited for trauma treatment. She also suggested talking to yourself reassuringly. Other techniques include vagal breaths, learning your triggers, and planning ahead by asking a friend to be your wing person in case of a PTSD attack. But in the middle of an attack, it can be hard to remember these strategies. Powell suggested creating a cheat sheet on your phone for easy tips on grounding yourself. There are a couple of medications available for PTSD treatment.
If the impact of the trauma has worn someone down so much that they're experiencing anxiety and or depression, then they might be prescribed an antidepressant. If they're having trouble really regulating their moods, sometimes there are new antipsychotics. Now, I encourage people to not be alarmed by this term. It's just what they're called.
Powell has a handy way of remembering things that you can do to minimize the impact of symptoms on your life.
Shine. S is to really work on sleep. H is to work on hormones. And so that's obviously reproductive hormones, but it's also stress hormones. Every time we get triggered, we're going to release adrenaline and cortisol, and then people get burnt out because their body's always in that state of over alarm. So learning how to calm down through mindfulness. I stands for infections. We could also say inflammation, reducing those. And then N is for nutrition. And let's not underestimate the role of the enteric nervous system, the gut. And lots of people describe gut upset in reaction to trauma, long-term trauma. And the last thing is exercise. And you see in that, everybody knows you get endorphins, you let go of stress, and you feel better, but nothing in excess, right?
There is ongoing research in trauma and trauma treatment. New strategies to deal with the overwhelming feelings caused by PTSD surface every day. Ashley Keller, The Health Insider.